again, I'm a PA and I'm lucky to be in my second year of fellowship here with our group. And, in talking about what time of year I was going to be giving this talk, I was trying to think of, what would be appropriate and fitting for, a large group of people, and what's something that would maybe be inspiring as we look forward to spring, hopefully. So I think for those of us that are in Wisconsin, it has felt like a bit of a long winter, and I think now as the last few days and looking ahead to some more consistent sunshine and warmth, hopefully this is something that can get everyone a little bit excited about what's to come. So today we'll be spending some time talking about the physiological benefits and as well as some medicinal applications of using homegrown herbs and plants. So my hope is that after today's talk, you'll be able to understand some of the research on the physiological as well as psychological benefits of gardening. I hope that you'll maybe take away some basic medicinal applications or home applications of herbs and plants that you can try yourself, with an awareness of safety considerations as well, and perhaps gain some insight into other community or online resources for establishing or supporting your garden if that's something that you already partake in. All right, so I know personally, gardening is not something I wouldn't call myself an expert by any means. I maybe 4 or 5 years ago when I was living out west, we had a community garden at my apartment that was kind of haphazard and a free-for-all. And then when we moved here, I kind of started to dabble in container gardening in my kitchen. And then now, since having a home the past 2 years, have kind of been exploring more raised garden beds, and I just have a little more space to do that. So I know some of you out there maybe have quite a bit of experience. Some of you maybe not at all, but I'd love if people would comment in the chat where they're at when it comes to gardening or growing things at home. Yeah, a couple A's, that's awesome. A couple B's and C's. With the help of my grandmother, that's awesome. All right, so it sounds like we've got a little bit of variety. Thanks, everyone. All right, so now we'll spend some time looking at some of the evidence behind gardening. According to Statista, in 2015, 1 in 3 Americans participated in gardening of some sort. And, I suspect that probably during the pandemic, that might have increased a little bit. I'm not sure of more recent data of, more recent years, but it seems like maybe our group has a little bit higher percentage than that right now, and maybe we can spark some interest in those who don't have experience. So, many of the benefits of gardening that I've listed here, I think kind of innately make sense to us. I think when we think about it, we know that it's getting outside and that increases our sun exposure, and it's a way to be physically active, and can increase our fruit and vegetable intake perhaps. And so, some of the research that we'll look at, it kind of falls into this, but I also wanted to focus on some studies that maybe had either unique designs to them or focused on underserved populations, to see how things look in those groups. So when we think about prevention of disease, in the salutogenic model that we're trying to continue growing here, we're trying to prevent disease and make that the norm versus finding things and treating them. And so I thought this study was pretty interesting. It was a longitudinal study by Simmons in 2006 out of Australia. And they looked at about 2,800 people who were considered free of cognitive impairment, and they followed them for 16 years. They considered multiple factors such as varying levels of alcohol intake, peak flow levels, so considering like respiratory health in some sense, if people had a diagnosis of depression, if they were daily walkers, daily gardeners, as well as education levels on development of dementia. And gardening was found to be more effective than walking, as well as those who maintained a low to moderate alcohol consumption, and education level in protecting against dementia over that 16-year span. So pretty interesting. I'm not exactly sure why men had a lower risk when they walked and not women, but gardening did it for both. So it's pretty cool to see. And then when we think about treating disease, as you might imagine, gardening, there's multiple studies out there that it's frequently shown to have benefits on mental health. And when we think about that, it provides many of the lifestyle things that we recommend for treating anxiety and depression between physical activity, light exposure, time spent in nature. And I think many people kind of get a sense of satisfaction in caring for something, having something to look after, and to see the progress as things grow and flourish. So in 2021, Coventry and his group performed a systematic review and meta-analysis of randomized controlled trials that showed the most effective nature-based interventions, so either gardening, green exercise, so exercising outside, or nature-based therapy were optimal when they were done for 8 to 12 weeks, ranging from 20 to 90 minutes at a time, for both those with pre-existing and new mental health problems in adults. When it comes to our physical health, the study in 2013 was done in Salt Lake City, and they looked at a community garden program in various neighborhoods. And they were looking to compare, people who had similar living situations, maybe they were in a food desert or not, trying to compare if there's any differences that could be gleaned from that. And so they compared the BMI, or the body mass index, of community gardeners to that of their neighbors, same-sex siblings, as well as spouses, that were adjusted then for their gender, age, and time BMI was recorded. Both men and women were found to have significantly lower BMIs than did their neighbors and siblings who were not in the community gardening program. So for women, that looked like a 34% lower odds of being overweight or obese as compared to their otherwise similar neighbors. And for men, that was 36% lower odds as compared to their neighbors. They didn't find a significant difference between siblings and spouses. I hesitated a little bit to include this just because I think we know that healthy weight obviously can impact disease quite a bit, but it's also possibly to be metabolically healthy even with a BMI over 25. And so I felt that I also wanted to consider the like qualitative reports of physical health and things that people reported from that standpoint when it comes to gardening. And I loved this study. It came out last year out of Detroit Community Gardening Program. And they interviewed primarily African American cohort to research the health impacts of gardening on racial and ethnic minority populations around the US. And so I believe the Detroit one was just one of the early um, locations for that. And so for those of you that are maybe on via phone, I'll just read the quotes from these participants. One gardener said, "My therapeutic gardening, I call it, because the knee problems and the back problems and the arthritis and all that seems to be better because of my movement." Another gardener who had lost function in his hand after an accident credited gardening with regaining hand function. He said, "The doctors told me that's all we can do for you. We can't do any more." I said, "Well, I know what to do. I will go back to gardening, which is something that will work my body and work my hand, and I have dug that garden across the street with my hands." So I think for me, these kind of firsthand qualitative quotes are almost more telling and special, I think, as we are lucky to hopefully sometimes have these conversations with patients and see when there's lifestyle things like this that are just as helpful, if not more helpful, than anything that we offer or prescribe to them. So when it comes to sun exposure, um, we we know more and more, or we're finding more and more about vitamin D and just its overall importance in prevention and outcomes, it seems, of so many different things, from bone health to mental health. The list goes on and on and on. And so naturally, when we think about sun exposure and increasing vitamin D levels, gardening is a great way to do that. Um, in this study, they looked at the serum vitamin D levels of about 2,300 elderly individuals who had varying pastimes. So it was like walking and dancing, cycling, gardening, weightlifting, among others. And to qualify, they had to be doing this specific pastime for 1 hour a week for the past month. And it was found that irrespective of age, BMI, season of the year, which I thought was pretty interesting, and comorbidities, regular gardening as well as cycling were found to significantly reduce the likelihood of inadequate vitamin D status. So for women, that was about 25% higher serum levels, and for men, almost 28% higher. When it comes to social interactions, our next benefit here, there wasn't a lot of quantitative data that I could find on social interactions directly linked to gardening, but again, this is something that came up so much in all of the studies, just as comments people made or things that people had noticed. And so when we think about social interactions, I know even myself, I've had multiple interactions and discussions along with like sharing of produce with my neighbors that I probably wouldn't have had otherwise, as we're out at night watering our plants and things together. So I thought this was a really interesting comment and just something I hadn't really thought about otherwise is, they said in this study that there's schemes out there that volunteers can help older people or people who might not be able to manage their gardens on their own. And, that benefits both the person volunteering as well as the owner of the garden from the social interactions that arise from it, as well as sharing, again, things that you grow together and having a common interest. So something to think about. Other kind of more notable findings and common themes. The United Kingdom, the UK kept coming up. It seems like they had so many studies out there that were published more recently looking at gardening and green exercise and green health for their communities. And I guess they have this national strategy that they're researching to see how it improves their mental well-being as well as the overall impacts on their health system. And so this project specifically was looking at ex-military personnel who had PTSD or combat-related mental health conditions. And these people participated in gardening as kind of an add-on intervention to a standard residential treatment that was 1 to 2 weeks long that they offer for mental health. And so again, these were just kind of themes that came up in a lot of places, but were specifically quoted from this veteran study, that people found a greater sense of purpose. Community gardening provided motivation and was a way to give something back. People appreciated anticipation. They had something positive to look forward to in their days. They said it helped instantly to feel relaxed and safe, which, is something that we all want for ourselves and each other. They found working at their own pace, learning new skills was beneficial for their mood and stress levels. Skills were transferable, so they could relate experiences that they had in their garden to their everyday life. The transfer of knowledge was powerful. Many people found meaning and purpose in passing along the knowledge that they had developed or learned to others, and found this to be a positive way to build confidence. And then stigma and understanding. Everyone who attended and was participating was in the same boat, in contrast to other things going on in their life or being misunderstood out in the civilian world. So limitations of the research. I think gardening as a whole is a little bit difficult to define. Study to study, what was involved varied greatly, and looks very different for someone. Whether you're watering plants in your kitchen or if you're lugging gallons of water across your backyard or long distances. Obviously there's a big difference there in the physical activity benefits. So that's one thing that's a little bit hard to quantify. And there's also a lack of standardized garden or approach, and so that kind of limits meta-analysis because research designs are not necessarily compatible to be compared directly. So in summary, this was another recent study in 2020 that looked at quite a few papers, almost 9,000, and included 77 studies that noted over 35 validated health, well-being, and functional biometric outcomes. And these findings demonstrated links between gardens and improved mental well-being, increased physical activity, and reduction in social isolation. So what does this mean for us as healthcare clinicians or people working in the integrative health realm? You know, I think a lot about like social prescriptions. You know, is there a way, when we talk about like exercise prescriptions, is there a gardening prescription, or a way to bring this up in conversation, or if patients bring it up as an interest to kind of support them or validate with some of these findings. I wonder about the impact that this could have on current or future community relationships and the ways we manage health. You know, is this an approach to help offset like the ongoing increasing burden that our healthcare systems are experiencing? You know, as a center now, are there other resources available through other things within UW? I imagine yes, that maybe I'm not aware of, but you know, I just think about like what a big agricultural presence is here in Wisconsin and within UW, as well as I'm sure there's, you know, botany departments and, you know, things that the list goes on and on that might already have some things in line. I was thinking a little bit about group medical visits. Last week, I was lucky enough to talk with Dr. Bruce Barrett and learn more about his eco-mindful wellness and that GMV. And I thought, is this something that people could learn these skills and develop something themselves in their own space, or again in a community setting that could be beneficial for our health. And then another thought that came up is how do we expand on this interprofessionally? So, you know, is there a place for dietitians and nutritionists to help with like recipe development from things that are grown? You know, is social work able to help, or can we connect those with food insecurity to community gardens, or offer food shares through those means? I also learned through looking into some things for this talk that the Verona Clinic already has a community garden out front of their clinic that's managed by the Badger Prairie Needs Network, and is a food pantry there. So I don't know much about it, but again, maybe that's something that we could start expanding across other UW locations. Thanks for your comments. I see them really briefly, but I look forward to reading them later on. All right. So what should we grow? I think the good news is a lot of the research, you know, doesn't specify, you know, there's no right or wrong seemingly, and so therefore it's up to you. And so some things that I would consider, you know, one, what do you like to eat? Are there things that maybe you would like to share with others or collaborate with others on that you can share back and forth? Are there conditions that you're looking to treat using plants or herbs? What will upkeep look like? I think for me, this is always a big one. I get really excited in the spring, and then come August, September, I'm like, oh, I haven't watered that in like 3 weeks. So, you know, what's feasible for you with your life, and taking care of these things throughout the growing process. And then probably maybe the biggest one, or the best place to start, is what does your space allow for? You know, are you looking to container garden in your kitchen and just have one or two small things, or are you using raised beds? Do you have a formal garden space where you live? And then lastly, you know, what will grow well in your area? So the USDA here has this plant hardiness zone map that I believe has been kind of tweaked in recent years and is now like more broken down even specifically. Here within Wisconsin, we're in zone 4, or central Wisconsin, I should say. We're in zone 4, and so oftentimes when you look at, if you pick up seeds, you can see on the back of the package, it'll have this map and it'll usually say what areas it grows well and have specific recommendations for the conditions where you live. It's a good thing to reference, make sure that you're not setting yourself up for failure from the start. Okay, so we'll spend a few minutes here just talking about the different ways to use herbs and plants and the different forms that they might come in. I liked this picture as a visual. There's certainly more than 6 ways to take herbs, but the definitions here come from our Integrative Medicine Fellowship. We have a guide to supplement formulations, and so probably the most common to many of us is going to be just complete or in the fresh form. So food used directly in the way that it's harvested. Examples of this, would be aloe, ginger root, or mushrooms. Infusions are going to be a water extract. So the herb parts are put in with boiling water and steeped typically for 10 to 15 minutes. So for this, I think a lot about teas like chamomile, peppermint, or green tea. And then decoctions are going to be a water extract in which an herb and water are boiled together. So these are usually more concentrated than infusions. And I think about this too in more like thick fibrous materials like roots or bark as compared to leaves or flowers. And this is boiled and simmered for 10 to 20 minutes, then strained. So the main difference between an infusion and a decoction is going to be the steeping versus simmering approach. Tinctures are going to be a solvent extract. These are made using a solvent like alcohol or glycerol. And standard extract is going to be a 1-to-4 ratio. So 1 gram of dried herb in 4 milliliters of tincture. So examples of this are going to be horse chestnut, hawthorn, or peppermint. Glycerites, these are solvents, or these use glycerin as the solvent instead of water or alcohol. And so these are great formulations for kids or those who don't maybe tolerate bitter taste because it's pretty sweet. And echinacea is a good example of that. Medicated oils, salves, and balms. So lipophilic extracts, fatty substances such as oil infusions in a base. These are often made with, again, fats or like a petroleum jelly. And tea tree and calendula are good examples there. And then lastly, a poultice is going to be an herb soaked in hot water and then applied directly to the skin, usually with like a cloth barrier wrapping around it. So arnica is a nice application for that for muscle aches. Okay, so now we will pivot a little bit and we'll look at some specific herbs and plants that you might consider growing or having in your space, or just being aware of them as potential ways to treat different conditions. So feverfew is our first one here. Tanacetum parthenium is the Latin name. The most common therapeutic use for this plant is going to be for migraine prevention. Fresh or capsule form have the best evidence when it comes to migraine prevention studies. Tinctures are available, but one clinical trial failed to note any benefit with that specific formulation. So keep that in mind. We use the leaves and flowering tops. And when it comes to safety considerations, generally this is well tolerated. Sometimes some nausea or GI upset can be noted. I guess probably the biggest one that might alarm people is chewing the leaves can potentially lead to oral ulceration over time. And so being aware of that up front and stopping if you were to experience that. We want to avoid use in pregnancy as it might lead to uterine contractions, and more research is needed on use while breastfeeding for feverfew. Okay, so our medicinal application at home. For migraine prevention, we say chew 1 to 2 fresh leaves daily. Stop, of course, if you're experiencing those oral ulcerations or any oral swelling. This, as we're using this as a preventative measure, people who use it long-term did note some withdrawal, 10% of people. And so it is recommended to taper off if you're discontinuing use. And generally this is best when the flowers are present, to use those leaves. One last comment or note on it is it does look a lot like chamomile, and so I always just say that too, to make sure you know what you're using, as or know that you planted that, as it can be a little bit confusing if you're just looking with a blind eye. Next, lemon balm. This is a great plant that's fairly easy to identify if you kind of rub the leaves together. It has a really, really nice lemony scent that you smell. And so this has good benefit for digestion, GI upset, and colic. There's been many studies that show benefit with lemon balm on anxiety, stress, and sleep promotion. Usually it's in combination with other agents, so it's a little bit hard to parse out, or there's not studies that show directly that lemon balm alone is perfect for that. And then it also is used for HSV or herpes simplex virus outbreaks in the ointment or topical form. This is also a perennial like feverfew. I understand it can really take off, and so some people recommend planting it in containers or in a contained space, or this would be a great indoor option for people if they didn't have an outdoor space. We will use lemon balm again in teas, tinctures, extracts, ointments, as well as just fresh in the complete form. And this is great because it's safe and it's well tolerated by all ages. There's no significant side effects noted. So for home applications here, there's two that I wanted to mention. One, lemon balm iced tea. I've never tried this, but it sounds delicious. You can take 1 cup of boiling water over 5 to 6 fresh leaves, or a teaspoon of dried leaves, and steep it and sweeten with honey to taste, and you can drink that as desired throughout the day. And then lemon balm pesto. I see Greta's comment in the chat, and I was going to share. I've heard great things about the Kufal Dooley lemon balm pesto, and so maybe she'd be willing to share her secret family recipe with us. But essentially, it's using lemon balm instead of basil in a pesto recipe, and so there's a lot of them online, and I think would be a delicious addition to many dishes. Mullein is next. Mullein might not be something that you like choose to plant in your yard. I think many people refer to it as a weed or find it to be like invasive at times. But I wanted to include this because once I was aware of this plant, I started spotting it everywhere. Like it's pretty recognizable with how tall it is and the yellow flowers, and it's something that I've noticed like along the Ice Age Trail and along the highway at times. And as a chronic ear infection sufferer growing up, I wish this is something that my mom maybe knew about. So um, mullein has some antiviral properties and is known to be helpful for ear infections as well as upper respiratory infections. We typically will use it in the like infused oil form as well as in teas and tinctures. Biggest safety consideration, the seeds are considered toxic, so it shouldn't be used in any preparation. It's going to be more the leaves and flowers. And when it comes to ear infections, we want to avoid use when we have tympanic membrane perforation. So still recommending people to have an exam and be checked out before starting this. So a medicinal home application for mullein would be a mullein and garlic oil. And so you would take a little jar, fill it with about 2 tablespoons of chopped garlic as well as mullein flowers. You cover it with olive oil and can leave it in a sunny window for 2 to 3 weeks. Or if you're under more of a time crunch, you can infuse it in a double boiler over low heat for 20 to 30 minutes. You then would strain everything out and put the oil in a dark tinted bottle, and you can use 3 to 4 drops in the affected ear every 4 hours as needed. So again, this is one that might take a little bit of advanced notice or preparation. Some people like to do this and just have it on hand for the winter if they know their kids have chronic problems. It also can be purchased over the counter too, but it's fun to make it yourself if you want to try. Next is sage. Sage I think of as a cooling herb. And so this can be great for menopause, hot flashes, people who complain of excessive sweating. It also is helpful for colds, coughs, sore throat type symptoms. Generally, the leaves are used most commonly and delivered via tea, tincture, as well as in the capsule form. Sage is not recommended internally during pregnancy or large amounts, so kind of anything more than you might like cook with or have in a meal for more than 1 to 2 weeks at a time. And this is because there's thiojones present in the essential oil of sage that is a main component of absinthe, and so it can be potentially neurotoxic if used in large amounts. They say that a tincture that's diluted with water or just used as like a gargle is okay to use for longer periods of time. So 2 applications for sage. One is going to be a sage gargle. So you can take an ounce of sage leaves. You can also include thyme in that if you're interested, and you grind it up in a coffee grinder or blender. Put it in a mason jar with some apple cider vinegar, and then over a period of 2 weeks, you want to shake it every so often, and then strain it and store it in a dark colored bottle. And then it can be used as a rinse or a gargle for sore throat, as well as just some people like to use it for like fresh breath. And thanks, Dr. Sharp, sage also can dry up breast milk, so something to keep in mind. And then the second one here, a sage tea. So just steeping a tablespoon of chopped sage in water and straining. You can serve it warm or chilled. I think for people who, were using this more for like hot flashes or menopausal symptoms, chilled is probably preferred. And you can add lemon juice or honey as desired to taste. Thyme has both antibacterial and antiviral properties. This is one that maybe many of you are familiar with if you like to cook or just from a dietary standpoint already. It can be great for cough, especially it's thought to have two mechanisms of action, being antispasmodic as well as expectorant. And so for this, often will come in the tea form, syrup form, or sometimes in capsules as well. And thyme is generally safe, especially in infusion form. Some people will note some GI upset. And with any essential oil, we want to avoid like high doses or prolonged use for weeks to months on end. So our home application for thyme is going to be this thyme cough syrup. You can pour a cup of almost boiling water over the thyme and steep it for 10 minutes. Strain it out and add in honey and lemon juice. This can be refrigerated for up to a week and given to those 18 months and older, 1 tablespoon as needed for cough. As a reminder, we want to avoid honey for those under 12 months of age. And so as we have fairly limited treatment options for cough specifically in kids or those under 5 years old. And so this is a nice, safe alternate consideration that you can offer. And I feel like this year especially, I've had so many parents and families coming in just saying like, my kid has never had a cough this long before. They've never been this sick before. And so it's nice to have something different to offer. Garlic. Garlic is ideally planted in the fall, actually, but I wanted to include it just because of how well known it is. I'm sure many of you already incorporate this into your life in one way or another. So if you are eager to grow it yourself, you'll be really ahead of the game for planning maybe when fall comes. But garlic in general has good antibacterial and antiviral properties. So therapeutic uses are known for diarrhea, coughs and colds. And then we also, there's some mild evidence for blood pressure or hypertension benefit, as well as reducing lipids and cholesterol. And that's from garlic has a mild vasodilation effect, so that's how it can help with our blood pressure. Delivery methods, I'd say generally fresh is great. Again, if this is something that you already incorporate into your life, or want to incorporate more, and then it does come in capsule form too. Safety-wise, it's safe when used within the diet. We do see a small risk if you're consuming large amounts. I know personally, like when I see on a recipe, I tend to like double the amount of garlic cloves that are recommended. But they say more than 4 cloves a day can potentially reduce platelet aggregation. And so we just want to be mindful of that in people who are on anticoagulants, or if they're within 7 days of a major surgery. Garlic is, when it comes to the evidence as well, it is best when used in the raw form, so cooking it can reduce some of the benefits a little bit. In general, I would just say, like, if you eat it how you enjoy it, but this salad dressing recipe here is great, just with kind of crushed raw garlic, in combination with some other seasonings, apple cider vinegar and olive oil. Right. And then lastly here, peppermint. Um, Peppermint is lovely, you know, I think also maybe familiar to many of us, and has some good evidence for IBS or irritable bowel syndrome. Also has indications for myalgias or body aches, muscle soreness, uh, as well as coughs and colds and tension headaches. Generally, the leaves and oil are going to be used in, again, in teas, capsules, lozenges, as well as this is a fairly popular topical. With peppermint, it can affect our lower esophageal sphincter. And so those people who might have uncontrolled GERD or are very sensitive when it comes to reflux, it can exacerbate those symptoms. And so being mindful of that, either avoiding or limiting the oral forms if that's something that someone experiences. So a home application for peppermint is going to be kind of a poultice of some sorts or a little compress where you can take a peppermint tea bag and pour over some hot water, let it steep covered for 5 to 7 minutes. After that, you can choose to add ice if you prefer a cool compress, or you can leave it warm if you like a warm compress. And dip a washcloth in and apply to the forehead for sinus or tension headaches. All right. So now we'll just touch on some other resources, both locally as well as online things that you might consider if you're looking to expand your knowledge or learn more about gardening yourself. Um, the Bruce, for those of you in Madison area, the Bruce Company Plant Desk, I've personally found to be very helpful. They, I think, are master gardeners. They're like people with a um, wealth of knowledge, but you essentially you can show up there to their stores. I know they have an email as well, or you can even call them with any questions, and they will send you more information than you probably ever wanted on the specific plant or herb that you're looking to grow. The city of Madison also, you know, there's many community gardens already established in the area. But I found their website super interesting to look at. They have a lot of information on the community gardens themselves, as well as other things, like using what's called terraces, which I guess is the space between your sidewalk and the curb if you own a home that, you know, technically is the city land, but they will allow you to garden on it or um, to take over that space yourself within certain parameters. And so they have information there on how you can do that, as well as other interesting things like how to, you know, promote pollinators with the things that you plant or grow. Um, so that's a nice resource. And then the Madison Public Libraries, you know, I think in general, I kind of forget about the library sometimes of like how much free knowledge is there of just ways to learn how to garden if you're new, or different approaches like using raised beds and all that can go into that. They right now actually are running their free seed program. So I believe there's 5 um, libraries that are currently giving out free seeds. And then they also have some programming going on for gardening skills that I saw they had one on like seed starting as well as container gardening programs. So check that out if you're interested. Online resources. Mountain Rose Herbs is a fairly reputable brand if you want to purchase herbs yourself. But they also have an interesting website with recipes, and they're, I will say, a little bit more advanced than many that I included here today. But for those of you that are eager to try or want to look at those, they have a lot of different applications and other interesting treatments listed there. And then lastly, Dr. Tiaroni Lodog is, for those of you that aren't aware, pretty prominent herbalist and physician who has spent most of her career studying herbs. And so she has a lot of different things on her website. She has this free mini herbal medicine making course that has like five free recipes and videos that she walks you through how to make these things at home. So that's pretty fun if you feel like you want a little more direct guidance or something to follow on video. And then resources for clinicians. The Natural Medicines database is probably going to be the biggest one that I reference as far as looking at potential side effects, drug interactions. They also do have a review of the literature, like the review of the evidence for each thing that you can search, as well as some consumer report data. So you know if you're recommending something that someone's going to purchase, that it's a quality product. And that's free access that we all have through UW. And then I made help link dot phrases. So for all of these, the kind of medicinal or home applications that were included today, I made the dot phrases that you can see here, .im, whatever it is, that you can share or offer to your patients if you feel appropriate. And feel free to steal or share those with whomever you would like. All right. So now that maybe you've heard some of the evidence or had more time to think about gardening in your own life, I'm curious just to see again where people are at. If anything has shifted, maybe not. But I'd love if people could share. And feel free, if none of these feel like an appropriate description for you, feel free to comment. All right, Greta's ready to get her hands dirty. Lisa's looking forward to planting. Yes, more sunshine. I think next week it looks like we're finally gonna get there. Last weekend I was working on this in between shoveling my driveway and helping a woman who got stuck on her street. And I was like, I really like, I hope this is applicable next week that things have shifted. So I'm glad that they have a little bit. And Mary Ellen asked if I could share the dot phrases. Absolutely. I can, maybe what I can do is share this slide deck with Sara or someone who can maybe email it out to the group, just either with the slides, or I can just copy and paste the recipes too, or the dot phrases. All right. So just a couple acknowledgements I wanted to include as well. I wanted to thank Dr. Vinny Manicchiello, my wonderful fellowship director, for all of his support and not only creating this talk, but the past year and a half of learning together and ongoing things to come, as well as Dr. Greta Kufal. I I really wouldn't be here without you. I probably would be living in a different state doing different work. So just forever grateful for you. And the rest of my colleagues here at Yahara, IFM, just truly our jobs are hard and no day is easy, but you guys all make it worth it. And so I'm just grateful for the support and trust that you have in me with working with our patients, as well as my other co-fellows who have supported me in talking through this the last couple of weeks and always make Thursdays a wonderful day of the week. Thank you all.